Thanks to CuriosityStream and my streaming service Nebula for sponsoring this video. Before we dive into today's video, I'd like to give a little preface. The topic that we're about to discuss is pretty polarizing. I would guess that there's at least a few people who clicked on this video and who will leave a comment without even watching it. If you're here right now, all that I ask is that you hear the points and then comment. This is a huge topic and there will always be more to discuss. And just because I say something in this video doesn't mean that other opinions are incorrect or should not be treated with respect. And I hope that you consider what I have to say with that same respect. So, with that out of the way, let's dive in. I'd like to start off by asking you to imagine something for me. If you're in a comfortable spot, you can even close your eyes for this. I want you to imagine that you're at home and your mental health is not doing so well. Maybe you've been depressed for a while, or maybe something really terrible has just happened in your life. A close family member died, or you just failed all of your college classes, or you don't have enough money to pay rent this month. That stress sits on your chest like a ton of bricks. The walls are closing in, and at the peak of anxiety, it feels like all hope is lost. You call a friend, and you tell them that you don't know how you can survive, and maybe it would be easier if you were no longer living. Your friend listens, comforts you, and gives you some good advice. Half an hour after you hang up, you hear a knock on the door, and you open it to see two armed officers standing in your doorway. You are already stressed, but now your heart is pounding. When you ask them what's wrong, they say they got a call from your friend about a possible suicide attempt. You try to wave them off and tell them that you're feeling better and thank you for coming. But those officers are thinking that if they leave, they can't be sure that you'll be okay. And so they tell you that they need to take you to the hospital for an assessment. As you leave your home, your neighbors peek out their windows and see you being put into the back of the police car. They're probably saying to each other, "I wonder what they did." After reaching the hospital, you wait for hours under armed security until you can be seen. Eventually, a doctor or a social worker comes around and talks to you for a bit and agrees that you're not a risk to yourself. Finally, the police who brought you there transport you back home. Imagine that. Imagine how stressful that would be for you. Imagine struggling with the decision next time you want to confide in a friend. Imagine being that friend and finding out you called the cops for a false alarm. Imagine if something had gone wrong and somebody got hurt or killed. And imagine how frustrating these calls are for the police. Why did it have to be like this? Law enforcement agencies have been under intense scrutiny for how they respond to mental health crises, particularly when the person is in distress and the end result is a use of force, and sometimes a loss of life. When these cases make it into the wider public, it sparks conversations about police training and protocol, and for good reason. But in all of these conversations about how we can improve policing, we never stop to ask the real questions. Why did that crisis call happen in the first place? Why is our current system so broken? And the big question, should police be responding to mental health calls at all? If you were asked to choose between a therapist, a police officer, and a doctor to support you or a friend with a mental health issue, your first choice probably wouldn't be the police officer. The primary role of police is law enforcement, and yet Over the last 50 years or so, they've become our de facto first responders to mental health crises. Law enforcement agencies were never meant to provide health care, and they were never given the direction or the tools to do that job. So how did this happen? To better understand our current situation, we have to look back to the 1950s and 60s. Around that time, the civil rights movement was in full swing, seeking equal rights for all people. And in tandem, there was a dramatic shift in how Americans approached mental health. See, mental health was pretty stigmatized. For many people, the choices were either that you toughed it out and kept it under wraps, or you went to a mental hospital, which were derogatorily known as insane asylums. But the 50s brought a lot of change, and society realized that the mentally ill needed to be treated rather than locked away. So the public started to view mental hospitals as cruel and inhumane. New antipsychotic medications like Thorazine and clozapine were hailed as a cure for serious mental illnesses, and inpatient mental health services were seen as too costly to taxpayers. All of these resulted in a groundswell of support for the deinstitutionalization movement. This movement sought to close asylums and move patients into federally funded community mental health centers. In concept, that sounds great, but in practice, it was a disaster. It effectively eliminated most long-term inpatient mental health services, and those community supports that were meant to take their place were wholly insufficient or just totally absent. As a result, a bunch of these patients were either handed back to their ill-equipped families or dumped onto the streets with no plan to treat them. Many of the homeless people that you see today were, or would have been, the mental health patients of yesteryear. And interestingly, the people who are most fervently in favor of bringing back psych hospitals today are parents struggling to help their mentally ill children within our insufficient system. But this is not a video about whether we should reinstitute mental hospitals, though if that is a video that you're interested in, let me know down in the comments. The consequence of both eliminating inpatient services and not properly funding community services meant that individuals with serious mental illnesses were not receiving appropriate treatment, which led to many, many more police interactions. And that brings us to our first issue. See, when police respond to a mental health crisis, they generally have three options for what to do with that person. Leave and hope that they get help on their own, take them to the hospital, or take them to jail. But as we'll see, these few options produce poor outcomes. So let's go through them. If the police leave a person to their own devices, they may have another crisis shortly afterwards that requires another police response, which is costly and inefficient. Or let's say that the police are effective at de-escalating the situation. Then what? Where's the linkage to ongoing care? The police may give you a card that has a bunch of hotlines that the person can call, but again, those are typically reserved for crisis situations. And if the hotline worker feels that you're a danger to yourself, well then guess what? They'll call the police too. Part of the issue is that police don't know of many community services for mental health, and frankly, there's simply too few services available. I mean, try calling a mental health or rehab clinic and ask about availability. See if there's a spot. It's hard. Police don't have the connections or the knowledge to appropriately respond in those cases, and so often the easiest option is just leave. But that means that a person in crisis just had a stressful interaction with law enforcement and didn't receive any assistance at all. Sometimes police decide to take a person to the hospital. Perhaps they could be a serious threat to themselves, but they're not aggressive. Like the example that we started off with, sometimes these hospital calls are just totally unnecessary, but the police don't have the training to properly assess a person's risk level. In other situations, people really do require intensive care, but the hospital is not nearly enough. When a person gets admitted into the hospital, they're often put on a 72-hour hold in the psychiatric ward. And then they're released back into the community when their time is up with a bus ticket and their discharge paperwork. Again, there's no real linkage going on to outside services. As you can imagine, this leads to a revolving door effect where people have encounters with police, are brought to the hospital, get discharged a few days later, have another encounter with police, and the cycle repeats. So, repeated interactions with the police and no real treatment or recovery. The last option is jail, and this is often the action taken with individuals who commit some kind of crime during a mental health crisis or drug-induced mental health situation. The alleged crimes can run the gamut, but the vast majority of people arrested in these situations are nonviolent criminals. Every year, over 350,000 people with serious mental illnesses are kept in correctional facilities, and as such, correctional facilities have become America's largest mental health care providers. Sadly, you can see a pretty strong correlation between the deinstitutionalization movement and the increase in incarcerated persons. The problem with sending these folks to jail is that once they're there, many individuals don't receive the treatment that they need and end up getting worse, not better. And they stay for longer than their counterparts without mental illnesses, not to mention the fact that after leaving jail, a criminal record often makes it hard for individuals to get jobs or housing, which then makes it harder to access health insurance or psychological services, which then further deteriorates their mental health. So it's no wonder that many of these folks end up homeless or in emergency rooms or reincarcerated. The problem with all three of these responses is that they create an incredible burden. They burden law enforcement officers who have to respond repeatedly to these calls with insufficient tools. They burden state and local budgets. And worst of all, they burden the individuals suffering from mental illnesses who are not getting the treatment that they need. I think we can all agree that the current system is not working. Police simply do not receive the appropriate training to respond to mental health crises. And this bears out in the statistics. People with mental illnesses are 16 times more likely to be killed during a police encounter. And at least 25% of people killed by police have a mental illness. There have been some notable examples recently, like Kelly Thomas, Nicholas Chavez, Lyndon Cameron, Walter Wallace, Tanisha Anderson, Daniel Prude. The list goes on and on. In 2016, one of these events happened 2 blocks away from where I was working. 38-year-old Alfred Alongo was distraught, and the police received calls from his sister saying that he was sick, wasn't acting like himself, and needed help. When the police arrived, they saw Alongo walking into traffic and acting erratically. When the police approached him, weapons drawn, they told Alongo to remove his hands from his pockets. Eventually, he did remove his hands from his pockets and pointed something at the officer with the gun pointed at him. Alongo was shot and killed. He was holding a vape cartridge. Now, some of you may hear that story and say, well, it's unfortunate, but what did you expect to happen? The guy wasn't listening to orders, and the police officer felt that their life was in danger. But let's examine the role the police officer plays in this situation. First off, there is substantial evidence that the mere presence of a weapon can increase a person's aggression levels. One study tested whether interacting with a gun caused any significant changes in behavior compared to people who interacted with a children's toy. The researchers found that people who interacted with the gun were far more aggressive and had higher levels of testosterone compared to others. So simply having a firearm present can make a difference in how both the police and the mentally ill act. Additionally, take it from the perspective of the person interacting with the police. You're already in a bad headspace, and now a cop shows up with a gun. It's not that hard to imagine a person feeling trapped, scared, and engaging their fight or flight response. And likewise, even if you haven't committed any crime, having the police respond to a mental health call implies that you did something wrong, or that you're dangerous and will be punished. It's extremely stigmatizing and can unnecessarily escalate situations. Plus, on a personal level, it just makes me really sad that we live in a world where police are so afraid of the citizens that they serve, that they're often so quick to assume that a person that they know is in distress is out to harm them. But that says more about modern policing and police training in America in general than it does about mental health crisis response. In 19 different countries around the world, including Iceland, Ireland, Norway, and the United Kingdom, police typically don't carry firearms, and somehow they manage to address mental health crises without them, resulting in very few deadly incidents involving police officers. When you combine all of this with what we understand about systemic racism and the reality that Black Americans and Brown Americans tend to be treated more harshly by law enforcement, you can see how those who have been most marginalized by society are also the ones most likely to face violence or death at the hands of police officers, instead of receiving the care that they need. This puts people's lives at risk, and it also leads to distrust and fear of law enforcement. Something needs to change, and the injustice of situations like Alfred Alongo's killing should not happen. But I also think that we've placed too high of expectations on our law enforcement officers. We're simply asking police to do too many different things. And as a society, we have underfunded mental health services and simply say, let the cops handle it. Like that's a reasonable response. But even the police don't want to deal with mental health crises. In addition to being incredibly time-consuming and costly, many police don't feel properly equipped to respond to these events. So, what can we do? Obviously, something needs to change, but what are the options? Well, I'd like to go through 3 different levels of change that I'd like to label retrain, reform, and replace. The first option is to retrain. Many have suggested that police simply need more specialized training to respond to mental health crises. In the late 80s, crisis intervention teams started popping up in various parts of the country. I can't speak for every police department, but in general, these teams are officers who volunteer to receive 40 hours of training on how to de-escalate mental health situations in order to avoid unnecessary use of force. Dispatchers are also trained to identify mental health calls so that they can send CIT officers specifically. And at this point, only about 15% of law enforcement agencies have adopted crisis intervention teams, which still seems really surprisingly low to me. Regardless, many hail these teams as the future of how police could respond to mental health calls. But there are some issues. First off, 40 hours of training is hardly enough. You can't even work at McDonald's with 40 hours of training, much less be good at your job. And for context, I had to complete a master's degree and 3,000 hours of training before I could be licensed to do my work. So it seems laughable that 40 hours of training is sufficient for something so complex and nuanced. Also, despite crisis intervention teams being around for a while, their efficacy has not been measured, so we don't really know whether they work. Finally, this is a voluntary training, which means that most police officers do not receive additional training on how to respond to mental health crises, despite encountering them frequently. Overall, this seems like the bare minimum that most law enforcement agencies should require, but it's not nearly enough. The second option is reform. Several cities like New York and Los Angeles have implemented co-response teams that have police teaming up with paramedics or mental health professionals to specifically respond to mental health crises. Of course, the police and dispatchers would still receive the training that we discussed earlier, so the idea is to create a more cooperative team with mental health professionals. I'm actually pretty familiar with this system because I worked for a while in San Diego, where they have the Psychiatric Emergency Response Team, or PERT. I also have a coworker who works as a member of this team, so I get the inside look. The advantage of this model is that, first off, you have a highly trained professional present to take the lead on de-escalating the situation. Likewise, as an unarmed civilian, these mental health professionals are often less stigmatizing and less traumatizing. And finally, as someone in the field, the mental health professionals can provide alternatives to jail or the ER by connecting that person to community services. The shortcomings of this model is that often these teams are few and far between. I can't tell you how many times I've called for PERT and specifically requested PERT, only to be met with non-PERT police officers because the PERT team on duty wasn't available to respond. Also, I've heard complaints from the mental health professionals in this system that they're sometimes treated dismissively or not as equals by their law enforcement counterparts. Now, this might be due to the fact that, again, this kind of training isn't required or valued in existing police power structures. This system is better than crisis intervention teams, but I don't see it being a fix unless it comprised a substantially larger portion of police forces, and until there's a shift in police cultural values and training. The final option is to replace, and by replace, I'm talking about creating an entirely new response team that does not include police. At least not directly. So, for example, it might be similar to the fire department or paramedics. When you have a physical health emergency, you call 911 and a dispatcher sends an ambulance to your location. But now, imagine calling 911 for a mental health crisis, and the dispatcher sends a social worker to your location. Simple, right? This is definitely the most controversial option, but I would like to posit that it's also the best option. In fact, there are already several locations that have implemented this system. In 1989, Eugene, Oregon founded Cahoots, which sends out a medic and a crisis worker in a van. No guns, badges, or police cars at all. They've responded to 20% of all 911 calls in Eugene and have saved around $4 million every year. In 2019, Olympia, Washington started a crisis response unit and now sends crisis responders instead of police for mental health calls. And in Denver, Colorado, they started a new program called STAR in June 2020 that sends a mental health clinician and a paramedic together to address mental health calls. The program's still growing, but in the hundreds of calls that they've responded to so far, none required police or led to arrests or jail time. Other countries have followed this model too. In Sweden, they've implemented a mental health ambulance service and have been deploying mental health professionals without police since 2015. In the Netherlands, a program called Psycholance responds to urgent mental health situations without the use of police in order to destigmatize and de-stress those going through tough times. And in Australia, they have the Crisis Assessment and Treatment Team, which is a group of mental health professionals that respond to mental health crises 24 hours a day, 7 days a week, without police assistance. The United States has done this kind of handoff from police to other organizations in the past. For example, prior to the 1960s, police were often the ones called to respond to medical emergencies. That's right, no EMTs, no paramedics. Police response times to these urgent issues were slow due to being spread thin with all the different calls that they had to respond to. And if the person had to be taken to the hospital, cops would just put them in the back of the police car without any care until they arrived. It wasn't until the 1960s that paramedics began to push their way into this sphere. And I mean push. Despite police feeling overworked and underprepared to respond to these medical emergencies, law enforcement agencies fought to preserve their role as first responders. But of course, things changed, and now it's hard to imagine a world without EMTs. There's actually a really good 99% Invisible podcast episode all about this story that's super interesting and much more in depth than what I'd said here, so I'll link that in the description. With big changes come big concerns, which are valid. Some wonder how it's possible to distinguish mental health crises from non-mental health issues. As we discussed before, there is formal training for dispatchers to help tell the difference. And of course, in the case of laws being broken, there's often a mental health component to crimes. In those situations, both sides need to be addressed. I could imagine a situation where the mental health response team coordinates with the police in the same way that police cooperate with EMTs or the firefighters in emergency situations. But perhaps the biggest concern for people is, what if the person in crisis becomes violent? Don't you want a police officer there to stop them? When people imagine crisis calls, they often imagine someone who's aggressive, armed, and psychotic. These are the kinds of situations that get covered in news and media because they're dramatic and attention-grabbing. But the reality is that these kinds of calls are extremely rare. Only about 5% of all police mental health calls involve someone who is aggressive and armed. And you know what? Mental health professionals can tell when something is unsafe. I've worked with the folks that most often fit this mold. I worked with homeless and recently incarcerated individuals with serious mental health and substance abuse issues. That Venn diagram of conditions means these individuals were the most prone to police contact and were also the most likely to be identified as dangerous. But I never felt I was in danger. I had the education and training to know how to de-escalate, when to ask for support, and when to remove myself from a situation. Now, that doesn't mean that all calls will be safe, but just because you're having a psychotic break doesn't mean that you want to kill someone. And I trust mental health professionals to properly identify when they would need more support, when they would need police support in those few cases. The truth is that most mental health calls come from people just like you and me. They're folks with anxiety, depression, or mood disorders who are having a hard time. So, would you want the police knocking on your door in a time of need? Because right now, that's practically our only response in the US. You know, there's a good chance that this video gets demonetized simply because YouTube doesn't have a very refined filter when it comes to discussions about sensitive topics. And honestly, that might have stopped me from making something like this in the past, but part of the reason why I feel comfortable now is because of the support that I get from Nebula. Nebula is a streaming platform that me and some of my creator friends set up to give you exclusive and extended ad-free content, and it gives us the freedom to experiment and talk about sensitive topics like this without worrying so much about demonetization or the algorithm. It's pretty great. It features YouTube's smartest creators out there, like Legal, Minute Physics, Philosophy Tube, and just a ton more. But recently, we worked out a deal with CuriosityStream, which is the best streaming documentary service that you're going to find out there. I mean, I'm always struck by how quickly I can find something that interests me rather than like browsing for hours. For example, I just watched Curious Minds Brain Health, which dives into different aspects of the brain, particularly the brains of teenagers when many of these mental health issues first develop. So here's the deal. For a limited time, when you sign up with the link below, you'll get 26% off of CuriosityStream's annual plan, which comes out to less than $15 for the entire year. And on top of that, you'll also get Nebula for free. And it's not a trial. You'll have it for as long as you're a CuriosityStream member. So just go to curiositystream.com/neuro to get both CuriosityStream and Nebula for $14.79. Clicking that link is what allows me to make videos like this, and I really appreciate all of you who support the channel. So thanks, y'all. So if we agree that a change must be made, how do we make it happen? There are plenty of roadblocks to stop effective change. Unwilling politicians, a harsh justice system that focuses on criminalization rather than care, a prison system that profits from high arrest numbers, and police unions and law enforcement agencies worried about what this change would mean for them and the power that they hold. Regardless, change can happen. I'm all for police receiving more training on how to respond to mental health crises. But we need to direct our money to the right things. If we keep throwing money at training officers, and that's all that we do, without addressing the system around mental health care, we're going to continue to have the same problems. It's too much to ask police to be social workers, addictions counselors, and mental health specialists on top of their role as law enforcement officers. So, petition your federal, state, and local leaders to fund community mental health services, demand that armed officers not be the first responders to mental health crises, and support organizations that prevent mental health crises before they happen in the first place. If you have any other action ideas, please leave them in the comments below. I would love to collect those resources for how to make this happen. Anyway, thank you for hearing me out. I know that there was a lot of ground to cover, but I'm curious to hear your thoughts. What do you think about police responding to mental health calls? Perhaps you have your own personal experience. Leave all that down below. Until next time, I'm Micah. Think about it.